a.m. So I know there'll be others who will still continue to join, but to be respectful of everyone's time, I want to go ahead and get started. My name is Ursel McElroy, the Director of the Ohio Department of Aging, and I want to welcome everyone today for the Alzheimer's Disease and Related Dementias Task Force meeting. We're scheduled to meet from 10 a.m. till noon. I want to, let's see here, still letting people in. Again, I want to thank you for being here today. I was not able to be here at last month's meeting, but I'm appreciative of you keeping the good work going. So at this point, I'm going to turn things over to Alex Lapso for the roll call.
Thank you, Director, and good morning, everyone. Same roll call as before. I will start with task force leadership, proceed in alphabetical order through the governor's appointments, and then I will proceed to our legislative appointments, and finally make mention of our representatives from executive agencies. I'll begin with Director McElroy.
Present.
Dr. Francis is excused. Addison. Beach.
Did you say Beach?
I did.
I'm here.
Is that you? Okay. Thank you. Blau.
Present.
Bolin.
Present.
Brockman. Brode.
Present.
Berman.
Present.
Drost.
Present.
Hockwalt.
Present.
Johnson.
Present.
Pakunka. Pakunka is excused. Mahajan. Reese.
Here.
Thank you. Russell. Schiffel.
Present.
Smith.
Present.
Stevick Rust. Thompson.
Present.
Van Runkel.
Here.
I'll call the name Addison. Brockman. Mahajan. Russell. Stevick Rust. Okay, moving on to our legislative appointments. I'll begin with Leader Yuko. Senator Wilson. Representative Creech. Representative House.
Present.
I'll call these names once more, beginning with Leader Yuko.
I'm here.
Senator Wilson. Representative Creech. Lastly, I will be calling the names from representatives from the governor's executive agencies, beginning with Director Corcoran. Director Ashenhurst. Ombudsman Lawbert.
Present.
I'll call the name Director Corcoran again. Director Ashenhurst. Director McElroy, we do have a quorum.
All right, so we can begin. Have you pushed out the meeting minutes and all of the documents to make sure people understand where they are?
Yes, I have. And so to everyone's benefit, prior to this meeting, I updated the invitation for this meeting with multiple attachments. One attachment includes the agenda, and in that same attachment are additional documents relative to committee assignments, committee details, descriptions, and expectations. Also attached to the invitation is the draft of the minutes from the previous meeting. And so at this time, we would like to approve the minutes from the previous meeting. However, we would like to provide some time, a couple minutes for everyone to review, and we will need a motion as well as a second in order to proceed with approving the meeting minutes.
Alex, did you push out two attachments with that email?
Yes, Doug, there are two attachments. One is the meeting minutes, and the other is the agenda and other documents relative to committee assignments and expectations, descriptions.
I'm sorry, I only saw one. I got it now, thanks.
Move approval of the minutes.
Okay, Pete Van Runkel makes a motion to approve the minutes from the previous meeting. Before we proceed to a second, is there anyone that still needs additional time to review the minutes?
So is there a motion? Is there a second?
Second.
I heard a second from Ombudsman Laubert.
All right, so they're approved.
Hearing no objection? Yes, Director, the minutes are approved.
All right, we're going to move through the agenda at a pretty good pace because we want to be certain that you have ample time to break into what will now be the committees during this meeting. And then subsequent to that, you can make some decisions on how your committees will continue to meet in addition to the time we provide here. You should see in the agenda, we'll cover our federal CMS grant updates, give you a bit of information about that in the RFP process. We will then speak more directly about task force business and the committees. I know there was a survey and information that was pushed out, and from that, we will be able to provide with you what those committees will look like, the descriptions of the committees, expectations, etc. And then, as I mentioned, you'll go into the sessions. Then you'll come back and report out to the full group, and then any general announcements we want to cover. With that, the CMS grant update, I understand in the last meeting there was discussion or announcement of the $4.375 million that will be used to support in part the work of this task force. This was something that the Department of Aging worked with the Department of Medicaid on in anticipation of the work of this task force. So we're really pleased that CMS saw it appropriate to help fund this work. What we've done is draft what we would like to have pushed out as an RFP. We're working really closely with the Department of Administrative Services. The idea is that within a 30-day time frame, we will, one, push out the request for proposal. In addition to that, we would also like to, within that 30 days, have the bidders conference where those who are interested will have an opportunity to hear more about it and have their questions answered. So again, within that 30-day time frame, we're looking to, one, have the RFP on the street, two, have the conference so that anyone who's interested can have their questions answered, and three, to have those proposals back. A little bit about what we're expecting from those who submit a proposal. I'm going to talk with you about the objectives. The idea is that as a part of our project, we would recommend and deliver solutions that enable Ohio and our communities to be responsive and supportive of persons living with dementia and those who care for them. We believe that by having this extra entity work closely with the Departments of Aging and Health, they can help to organize and coordinate many of the task force activities, support the members and stakeholders to ensure compliance with Senate Bill 24, delivery of its requirements, and design and implementation of the recommendations. So the approved work plan that's responsive to the mandates of Senate Bill 24 is one of the objectives we expect to be able to meet with this additional assistance. They will have to consider the task force members' planning, preferences, and achieve the scope of work within the completion deadline that we set forth. They would also be responsible for a draft report that includes the task force findings and recommendations. They would be responsible for an improved final report that includes the task force findings and recommendations and an improved implementation plan that will be organized into phases that include the development of the work, training, priorities, the partners, strategies, and measures. So we have laid out what we believe is a pretty comprehensive scope of work for the respondents to the RFP. For example, activity 1, they will guide the project, they will support the task force and committees and ensure that the project achieves the expectations of Senate Bill 24. They will do so under the direction of the Department of Aging. Again, they will support the task force work to consider and make findings and recommendations about trends in the state's Alzheimer's disease and related dementias populations and service needs. And within there, we have identified some very specific things that we would like to have considered. Activity 3, they would support the task force work to consider and make findings and recommendations about existing resources, services, and capacity relating to the care of individuals diagnosed with Alzheimer's disease or related dementia. 4, they will be responsible for supporting the task force work to consider and make findings and recommendations about the policies, procedures, and regulations that address many of the things that are outlined within the bill. And then finally, they will support the task force in developing findings, recommendations, and strategies for inclusion in the final report. They will consult with the Department of Aging as necessary to build or adopt the necessary facilitation tools and discussion framework to enable the task force to effectively perform its mandate. Within the scope of work, it is about 2 to 3 full pages long, and it lays out in detail each activity that we expect for the respondent to be able to complete. So this will, I believe, help us to not only organize the work, but to accelerate the work. Certainly, you have been brought here to be the content experts. We will utilize this entity to help us to facilitate these discussions, to help us to, in a very strategic way, frame up our recommendations and to help us lay out a plan for implementation. I think many of us have been a part of groups that have really good plans in place, but we want to make sure we go the extra step that we have an implementation plan in place as well. So not only recommendations, but clearly lays out how we will implement. So this is how we will in part utilize the funds that we were able to secure from CMS. And I think that this will provide us with the blueprint and the really good work that's needed to frame up what we come up with here, but also to be able to look for some of the work we need to do down the road and in the future. So I wanted to be certain that you were aware that that is underway and that we have a really good plan in place on how we want to push that out, and that we will have the support we need as a task force to have the deliverables that we're called upon to provide. Any questions or comments around that? I think I see hands up. I think I see a hand. I see a hand, and then I see Doug Beach, and then I think I hear Pete Van Ruckle. So Doug, do you want to go first, and then Pete?
Yeah, just quickly. So the money from CMS will be the planning document to put legislation in place. Is that the way I'm understanding it? Or will it also have some implementation dollars with it?
There are absolutely some implementation pieces. This is just to help us to strategize and stand up. So there are certain deliverables that we have to meet, and being able to use it to help us with the planning and implement. The planning is really key so that we're on task when we implement. So it's not limited to that by any means. This is just a part.
Thank you.
Mm-hmm. Pete, I thought I heard your voice. I don't think I see your hand, but I think I heard your voice.
There's my hand.
Did I hear you?
You did. Sorry.
Okay.
I guess I wasn't following the protocol. So, and I apologize if you answered this already and I just didn't hear it. When are you thinking to have this RFP on the street, and when are you thinking to have it? Have a decision made on who this party is going to be?
Right. So we hope to have it on the street here, hopefully in days. We have drafted and done everything we need to do, and we're working alongside the Department of Administrative Services. Ultimately, they push it out on our behalf, but everything that has been required of us, we believe, provided, and we will continue to stick close with them. We will consult with them back and forth on this process, but we're really hopeful that it happens here within the next several days.
And then, as far as like what in the RFP, what have you given as the time frame for submission, review, and eventually the decision?
Right. The idea is my understanding is that we're looking for it to be out for 30 days. So within that 30-day time frame, it would be out. We would have the bidders conference, and the submission would be due. That is what we're working toward, 30 days for that process.
Thanks.
Mm-hmm. I don't think I see any other hands, or if there are any other comments. So I have Jennifer Blau.
Yes, good morning.
Good morning.
Would it be possible for you to share the document that you were reviewing about expectations from each of these groups that will bid with us?
Yeah, once the RFP is in a good state, my understanding, once it's in final state, it will be pushed out. It'll absolutely be shared with this group. So you will have it in its totality. You will have it.
Wonderful, thank you.
Mm-hmm. Absolutely. Any other questions or comments about the RFP and where we're going with this? All right. Jennifer, did you want to keep your hand up, or just forget to take your hand down? I want to make sure. Okay. I think I see a hand from Sally Bowen.
Yes, good morning. Is the time frame for when the work is to be completed, I'm sorry if you said that and I missed it, it's still, I think it was by end of August or something like that. Is that correct?
I think there are different phases, and Julie's on here, and I think some of those things are still to be determined. I mean, we have some flexibilities with the dollars. At the same time, we understand we have some expectations of what that group can provide. Julie, I don't know if you want to weigh in on that, because I see on here that the contract would be looks like we were looking at through September 30th. But I don't know if that will change or move, but I think we had laid out this particular piece through September 30th, which would line up with the federal fiscal year. Is that right, Julie, or is there anything you want to add to that?
Yeah, that's right. Good morning, everyone. This is Julie Trackler. There's flexibility with the funding timeline. And so what we're thinking with the RFP is, again, the first phase is completion of the report, supporting the task force along the way. And phase 2 is the actual implementation, and that would run for the next biennium. Okay.
Great, thank you.
Welcome.
All right, so seeing no other questions, I think we're going to move on. I'll talk now about the committees. Again, there was a survey that went out, and I think that we've tried to review a lot of the information that's come in so that we can have a pretty solid committee structure. And so Julie's going to walk you through the committee titles, give you a brief description of the committees. Actually, some of this information should be included in the attachment that Alex did send out right before the meeting. We'll also talk a little bit about leadership and facilitation. There were some who indicated they would be willing to step into either of those two roles. And so you'll see the membership. There's also a membership list that you have in that attachment. And then Julie will go a bit more into some of the expectations. So Julie, I'll turn this over to you.
Okay, very good. Thank you. Let me shift over here. And so again, in your in the packet that Alex sent, or it was included in the updated invite, is everyone able to see that? There's the agenda, and then behind the agenda, there's several more pages. And so what we'll do is just walk high level through these documents, and then our plan, as you can see on the agenda, is to break out into these committees and kind of dive in a bit more relative to each of the the capacities and scope of the work to be done. So if you look at the document after the main agenda on page 2 is committee assignments, and as you know, a second survey was sent out asking for your interest in serving on one of these 3 committees. And we ask you to give first, second, and third choice. And then there was also a question if you were willing to serve in a leadership, like a chair capacity, facilitator capacity. And so what we've done is organized everyone into one of these 3 committees. And there is you're on at least one, you're on one committee, and every member is assigned. So at this point, there is the capacity committee, and you can see who's on that committee. We have Sally Bolin, Leanne Smith, Representative House, Senator Wilson, Joe Russell, Pete Van Runkle, Gene Thompson, Rodney Creech. With Sally Bolin, Leanne Smith, and Representative House expressing interest in serving in chair or facilitation role. And our thought is when you break into your groups, you can determine who serves in those roles. And again, you can further define roles as you see fit. The Science Committee, Trey Addison, Greg Sinney, Bonnie Berman, Lori Stevick-Rust, Jennifer Drost, Tina Halkwat, and Varun Mahajan. The Experience Committee, Pam Reese, Catherine Broad, Rhonda Johnson, Doug Beach, Melissa Schiffel, Lisa Brockman, Jennifer Plow, Leader Yuko, Diane Pakunka, and Beverly Lauber. And again, Science Committee expressed interest, Trey Addison, Greg Sinney, and Lori Stevick-Rust in serving in a lead role, and under Experience, Pam Reese, Catherine Broad, serving in a lead role. So that is the assignments that have been made for these committees. And so then if you want to, if we'll move on to page 3 of your handout, this is the breakout session, and we know because this is, you haven't seen this until now, we wanted to give you a proposed agenda that you could walk through. And on the main agenda, there is toward the bottom, there are 3 new links that you'll use to leave this meeting at the time. We'll tell you when that is. And you'll go into your committee meeting using the link on the main agenda or a phone number. if you are calling in. And then at the end of that committee session, you would then leave that meeting and then return to the main link that you were given for this main meeting, and we'll do report outs and final action items. But for the committee breakout, proposed agenda would be just welcome introductions, just learn who each other is, hear a little bit about each other. And then we'd ask you to take a look and review the documents that you've been given today, the committee descriptions, the related topics for Senate Bill 24, and I'll walk through that a little bit more. There's a proposed timeline, and then we'll talk about guidelines in your breakout committees. Alex Lapso, Tessie Pollock, and I will join you, and we can talk and listen to your perspectives about, additional guidelines for operating. And then just a kind of a round robin conversation among all of you to discuss the proposed way that you would work as a committee. We'd like you to schedule your first meeting, date and time if that's possible. If there's any assistance that you need, we'd like to understand what that is, and then any other thing that you choose to talk about. So that is the proposed agenda. And again, you can defer and do other things, but at least hit those items 2, 3, and 4. All right, and so then let's the remainder of the items starting on page 4 and 5 of your handout. We have explained and provided description of each committee. So really what the scope and deliverables are for each committee. And so does everyone have that in front of them? I mean, Director, do you want me to read these descriptions for people that may not have it handy?
Sure, just a quick highlight, yes.
Okay.
So we can move them on to their meeting, yeah.
Certainly. Sure. So again, organized into 3 committees, with everybody, of course, obviously serving on the main task force and reporting back. The capacity committee is expected to assess Ohio's current and possible capacity to serve individuals living with dementia and caregivers, specifically including the services available in Ohio for those individuals and the ability of healthcare providers and facilities to meet the individual's current and future needs. The committee's work should include an analysis of Ohio's capacity of the healthcare system, including healthcare professionals needed to meet the growing number and needs of those with Alzheimer's disease and other dementia. How Ohio can equip and prepare these professionals and others to better support and care for the individuals, along with an array of other recommended interventions. An analysis of the role of state government and its policies relative to those living with dementia and those who serve and support them, and the fiscal impact of dementia on publicly funded healthcare programs. The committee should also integrate relevant findings of the Science Committee. Summaries along with findings and recommendations should be authored as a result of your analyses for inclusion in the report. So that is the Capacity Committee. Science Committee is expected to identify new and best practices that support early detection and progressive interventions that support Ohioans living with Alzheimer's disease. Efforts should equally be focused on methods that position Ohio to harness research and science that can be integrated into clinical practice. This committee should also infuse assessments of the current state of interventions used in Ohio's various settings of care and identify the gaps that need to be addressed. The committee should also consider quality care measures, training, and the current state and ability of Ohio's healthcare and long-term care settings to implement these interventions, and also recommend like transition strategies that heighten successful adoption and use, because we recognize that they may need some extra assistance to ensure success. The committee should also integrate relevant findings of the Capacity Committee and seek information from the Experience Committee to guide analyses. The analysis of the State Action Plan on Aging is also encouraged relative to population health needs of those with dementia, their caregivers, and healthcare systems needs. Again, these summaries along with findings and recommendations should be authored for inclusion in the report. Finally, the Experience Committee is expected to gain a comprehensive understanding of the needs and experiences of persons living with Alzheimer's disease and other dementia and their caregivers. Analyses and findings should be informed by personal narratives expert and community perspectives, research data, and other approaches as determined by the committee. Efforts should be made to ensure inclusion of all populations with special consideration given to the very collective and unique needs due to race, gender, socioeconomic status, religion, sexual orientation, disabilities, risks, and comorbidities or other factors. The Experience Committee should also address their charge listed in the referenced table of topics. The committee should also collaborate with and contribute to other committees to inform and strengthen the findings and recommendations that improve the experiences for persons living with this disease and other dementia, as well as their caregivers, healthcare providers, long-term care facilities, and community leaders and businesses. Because again, we know this is it'll take a village. Summaries along with findings and recommendations should be authored for inclusion in the report. So that is the 3 committee descriptions. And again, you can speak more about those and review those during your meeting. So hitting and finalizing this overview, on page 6 of your handout, you will see the list of topics from Senate Bill 24. And what we've done is, and what we ask you to do, is take a harder look at all of these. We have identified where we think where we believe there is a relationship to your respective committees. And you'll see those listed on the side there. And so if there is a diamond, we think there is a relationship or some correlation to your committee. We would ask you to look at those and let us know if you see changes relative to your own committee, or even other committees for those 28 items. And then finally, I'm sorry, Director, one final thing. The final page on page 7 is a draft timeline, and the driving milestone listed are the committee meetings along with the expectation of when the final report is due. So again, take a look at that and let us know your feedback relative to that. And so I think, Director, I can turn it back over to you.
Right. I think we do have a piece here with Tessie, but beforehand, I want to make sure. It looks like I saw a hand up. Now I see it's down. I thought I saw a hand up. If you had your hand up, please feel free to put it back up. Or if not, okay. Bonnie, it looks like it was your hand. Bonnie, and then Pete.
Yes. So thank you for this opportunity. I may have missed a handout, and I wonder if we are able to know which position in the task force each person serves or is representing, so that when we meet as small groups, we know who to consult with. So as an example, I know someone is representing the research community. So for each of us, it would be really nice to know who we can consult with or who's representing somebody else. Do you know what I'm getting at?
Yes. Okay, so we can make more clear sort of who you represent in that space, each one of these groups. Absolutely.
Appreciate it.
We could do. Absolutely. Pete, I see your hand.
Sorry, I had to get off mute there. Go on the timeline, and I guess this is broader than the timeline. To what extent will the contractor be interacting or participating with the committees, and at what stage in the timeline, if there is going to be that participation, could we expect that to start?
Right. Ideally, and that's why we're working with trying to stick close to this 30-day time frame, because our expectation would be once that selection is made, that we get them right into the work. Because the sooner we can get them in the work, the better engaged they will be to help us frame up what we're doing. So once that 30 days hits and we're able to make that selection, I mean, we're trying to get them in shortly thereafter. And so they will then have an opportunity to meet with each of the committees, meet with us as a full task force, but then all of the committees as well. So as soon as we can get that selection done, we will integrate them into your work.
Thank you.
Any other questions or comments? Bonnie, did you want your hand still up or did you just not take it down? I see your hand up on here.
You know what? I bet it just didn't go down. I'm sorry.
Okay. All right. No problem. No problem. All right. I don't think I see any other hands. So seeing none. Julie, did you want to move into Tessie with as far as public meetings and sunshine, and then we can go ahead and move folks into their groups?
Yeah, certainly. And again, so Alex, you did send an updated agenda, and behind that are all the handouts. Did anyone else not receive that? Because again, we want to make sure. So just give a shout out if you did not receive it, or put it in the chat so that we're aware. But it should be in your updated invitation. So moving to the next piece, what we want to do for just a few minutes, and Tessie Pollock, our Chief of Communications, is going to talk with you about and give just a refresher on the requirements and parameters around public meetings and open meetings. And so just so that everyone is on the same page, because this is a public meeting. So, and as well are your committee meetings. And so to that end, I want to shift over to Tessie, and you have a deck that you're going to bring up to share with everyone.
Yep. Can you see that okay?
Mm-hmm. Yes, we can.
Very good. All right. Thank you so much. I appreciate it. Thank you for giving me a few minutes to talk about open meetings. While I am not an attorney, I was at the medical board for several years prior to joining the Department of Aging a few months ago. So I'm quite familiar with open meetings. We had, monthly board meetings as well as a number of committees that were ongoing. So I'm pleased to share with you this information. And as Julie mentioned, it is important to keep this in mind as we move into our committee work. While it's very easy to do for the full task force, committees tend to meet more frequently at irregular times. So we just wanted to make sure that you're keeping up with the expectations of open meetings as we do form our committees and start to meet more frequently. So today we're both going to talk about the definitions and obligations about the Open Meeting Act. So who is subject to the Open Meeting Act? And this is any board, commission, council, or similar decision-making body of the state, such as our task force and our subcommittees of that task force. A meeting is considered a prearranged gathering where a majority of the members of the public body are present and they're conducting or discussing public business. So if you have a committee with 5 individuals and 3 of you are gathering to talk about the scope of work that you would like to do, and you did plan to meet tomorrow at 5 o'clock, that would certainly be a public meeting. When we do have one of these public meetings, we need to make sure that we're giving appropriate notice and that we're taking action, having our discussions and deliberations in an open session. And then we'll also need to take and file meeting minutes. Again, this is something that we really wanted to make sure we were discussing as we move into committee work, because each of those committees will be expected to give notice of when they will be meeting. We will need to do minutes of each of those committee meetings. When we come back as a committee, we'll need to vote on the approval of those minutes in that public session. It's not something that we can do via email or in communication that is not open to the public. There are several different kinds of meetings. Of course, we have our regular meetings. We've talked about holding a special meeting where we wanted to hear from the public and other stakeholders. That too needs at least a 24-hour advance notice to take place. And then there's also emergency meetings that can take place. I don't anticipate that happening with this task force, but it's something that we did have to do with the medical board, and it is allowable. The openness of the meeting. So this needs to happen in a public forum, and the public needs to be able to come, to join, to listen. We don't necessarily need to have public speaking or input at those meetings, but they do need to be able to hear the deliberation and the discussion that's taking place. These meetings usually have to happen in person, but because, of course, of the emergency, the COVID-19 pandemic, we are allowed to meet electronically, which is tempting because then you tend to not give the notice that you did when you were in person. But again, we need to make sure that we're giving notice so that everybody can attend virtually. For this meeting, we are live streaming on YouTube. That's how we are inviting the public to join us. Today's committee meetings, we have shared the Teams links with individuals so that they can attend those. When we have committee meetings that are not occurring concurrently, we do intend to also live stream so that anybody can attend and listen in. Again, voting, such as things on minutes, we need to make sure that we're doing that openly and that we have a motion and a second and an approval by all. We are also allowed to have an executive session as part of our meeting, at which time the public is not allowed to attend. Again, I don't think that's something that we'll see here in our task force with the work that we're doing, but it is allowable, and we just need to outline the specifics of that when that does happen and vote on moving into an executive session. Meeting minutes, again, we need to make sure that we're keeping those minutes that after they are approved from draft and moved into approved minutes, we are publishing those. The communications team here at the Department of Aging has prepared our website so that we can host all of our meeting notices. We're hosting all of our minutes there as well. And so if you are planning on having a committee meeting, just let me know. You can shoot me an email at tpollock@age.ohio.gov, and we can help you with noticing that meeting and all the other information that you need. I can also collect your minutes for you and get them published to our website so that they are available to the public. And that is it. Thank you so much, Julie.
Very good. Thank you, Tessie. Any questions?
Yeah, I've got one, of course, Julie. There was mention of minutes made. Does a member of the committee have to take the minutes, or is there going to be an assigned staff person from the department or from the administration who will be supporting the committee in doing that?
Yes, it's our thought that a member of the committee will be taking those minutes for the committee. When we ask for individuals interested in leadership roles for the committees, we ask for a chair of the committee, as well as somebody who would be available kind of for the administrative support of that committee as well. So we would expect the committees to work on their minutes, please.
Thank you.
I have my hand up. Can you see it?
Yeah,
Great.
I see it now. Go ahead.
Quickly, in another state where I used to work, the Sunshine Law, whatever we're calling it here, was would prohibit committee members from talking about the committee outside of the meetings. Is that prohibition in place in Ohio as well?
Yes, it is, although you would need a majority of your committee. So if you were just discussing it with one other individual, that would be okay. But if you are meeting with a quorum of your committee, again, if you have 3 out of the 5 members, that needs to be a public meeting.
Yeah, it only took one person there. So if 2 people talked, it had to be announced. So thank you.
All right. So is there anything else, Julie, on this piece? Because we're at 10:45. I want to make sure that at a minimum they have 45 minutes to get in and begin organizing.
No, I think
looking at the materials.
I think we are in good shape. And again, Tessie, you will be joining the Experience Committee. Alex Lapso will be joining the Capacity Committee, and I'll be joining the Science Committee just to be supportive.
Okay, so I believe in your information, you have a link to your respective committee sessions. It's my understanding if you click on that link, it'll take you to the meeting you should be in next. And for those of you by phone, I believe you can dial in as well to the numbers that were provided. And if we could have each one back, let's go ahead and set 11:35. So pop one back to the main link, and then we'll do a report out and just to see how we are with our organizing and see how we're going to move forward. So we'll see everyone back here at 11:35.
Thank you.